Welcome, everybody, to this webinar covering instrument logistics routines within the dental office. The presentation, the webinar, will be in 3 sessions. We will start with a short introduction, and after the introduction, there will be a short film, short movie, 3 minutes covering logistic routines. And after the film, I will come back and go through together with you all the different steps on how to reprocess your instruments and how to have safe and proper logistic routines within your dental office. My name is Michael Zimmerman. I have a background from the dental faculty, the Karolinska Institute in Stockholm, Sweden. And I've been working with hygiene and infection control issues for the last 30 years, both within dentistry, within the medical field, and I have also had assignments for the Swedish Armed Forces, Swedish government, and regulatory affairs concerning hygiene and infection control. And I've also been working closely with the medical and dental industry. This webinar I'm doing together in cooperation with Directa Dental Group. Together with Directa Dental Group, I am also the inventor of the Practipal tray system, being developed by the Directa Dental Group. And during this presentation, I will be using the Practipal tray system as an example on how to go through different procedures within your office to have a proper logistics. There are, of course, a lot of different methods how you can reprocess your instruments. And looking on this slide, on the left side, you will have all the steps necessary when reprocessing your instruments. And on the right side, the orange boxes, you see example of all the different methods that could be used. And irrespective of what type of reprocessing methods being used at the clinic, the requirement, the final requirement, must always be that all instruments and items must be sterile at the point of use. So without giving any value to whether certain methods are better or not, the end result must always be the same and can always be the same if you carry out all the different procedures in the right way and in the right manner. After the film, which we will go through now, I will get back to you and cover all the different steps while reprocessing your instruments. So see you soon again. So now we are back after this introductory film, which was an example of how different routines can be carried out at your clinic. Either you do it manually or you do it with tray systems. And as said before, the most important thing will always be that the end result will be the same. So I will go through with you in this presentation all the different steps necessary to safely reprocess your instruments. And as you can see on the left side of this slide with all the green boxes, there are a lot of steps that needs to go through during the reprocessing of your instruments. And depending on what type of method you use, it will need different attention, different resources from your personnel and from your dental office. The orange boxes, the different steps, they can either be carried out individually, but in many occasions you can also combine the different steps. So you should not see these orange boxes as single steps, but a multiple set of steps that needs to go through in different combinations to render safe and sterile disinfected instruments. Decontamination, pre-disinfection and cleaning, for instance, can all be added together during the same procedure if you do it in the right way, in the proper way. And as mentioned before, the requirement, irrespective of the reprocessing method, must always be that all items and all instruments must be sterile at the point of use. Now, in the oral cavity, it is impossible to carry out sterile procedures. The oral cavity is heavily loaded with all types of microorganisms. So whatever we do to carry out our procedures in the oral cavity, there will always be a risk for contamination from the oral flora that is already there in the oral cavity. So the main issue with reprocessing the instruments within dentistry will always be that we cannot add anything to the oral cavity. So the instruments must be safe from all the previous treatments. So therefore it is more accurate to discuss sterilization of instruments and to keep the instruments during transport and storage as safe as possible. Additional requirements during reprocessing and handling. All logistics must be efficient, hygienic, and it must also be safe and simple for the personnel. We must make sure not to risk any injuries for the personnel, not to risk prick and puncture wounds. And it should also be a reliable system and hopefully also a time-saving system, so that valuable personnel time can be used instead to deliver care, taking care of patients and doing administrative and quality work within the dental office. Today, hygiene and infection control are extremely important. Hygiene, infection control and infection prevention are extremely important issues. It is very, very closely connected to antibiotic resistance, and we must work in a way so we always are preventing all situations where there may otherwise be a risk of having to use antibiotics or other antimicrobial drugs, either antiviral or antifungal. So our our hygiene and infection control program must always strive at to keep patients as healthy and non-infected as possible. In dentistry today, the equipment that we use in not only in dentistry but in healthcare in general must meet requirements on medical device directives on an international level. They must also meet standards on good hygienic standards, and there could be no risk of health hazards, neither for patients, staffs, nor visitors. And this is where logistics comes in as an important issue. We need to know the actual need of instruments and articles to carry out all the procedures being done in the dental office. We need to look at the profile of the dental office. What type of care will be delivered? Is it a prosthodontic clinic, a perio clinic, or an ordinary general practitioner? How often are sterile articles needed? For what type of treatments, and how many treatments over a period of time? What instruments and consumables are needed? What type of treatments will each specific dental office carry out? And how many treatments do we want to manage by the amount of materials and instruments that are in circulation at the clinic? And here we have to evaluate how long will the reprocessing time take, and we have to match the reprocessing time with the amount of patients being treated at the clinic. And in the end of this presentation, I will get back to how you can do these calculations in a very effective and simple manner. Within logistics, we must also plan for maintenance and reprocessing, maintenance and service of our instruments. And we need to overlook if there is a surplus, if there is a redundance of instruments. The more instruments there will be in the office, you will also need larger storage areas. And with more instruments with a larger storage area also comes a need for more personnel to take care of surplus instruments. And in many cases, in many clinics, we have way too high amounts of instruments that are actually never used in circulation in the clinic, but instead are spending space in storage areas. When discussing dental and surgical instruments, we must also consider not only maintenance, but the longevity, the lifespan of our instruments. And the more care we will take of our instruments, the longer will also the lifespan be. And in reprocessing are some very crucial, very important facts that has to do with corrosion and damaging of instruments. We need to see to the instrument's accuracy and precision, which is highly affected by how we take care of the different instruments in different situations. And of course, longevity and the accuracy and precision of our instruments will also affect the quality of care being delivered. And here we also have to consider life cycle cost, and not only the life cycle cost for carrying out the reprocessing, the processes, or the treatment. We must also consider the life cycle of the treatment rendered by the patient, and the life cycle cost depending on the lifespan of items and instruments. When seeing the setup, when preparing the workstation, there are several options, of course, as we saw before with the green and orange boxes. We could either work with single instruments, ad hoc, just to put forwards the instruments needed in a very actual situation. We can also have items selected during the treatment, or daily preparation of individual trays at the tray prep stations, where trays could be prepared in accordance with the daily scheduling of patients. Or there could be pre-prepared trays depending on what type of treatment should be carried out. with the trays. As in this example, here is a preset tray for endo treatment, which actually include all the instruments that are needed at the clinic for carrying out endo work. Now, it could sometimes be difficult to arrange that if you are several dentists at the same clinic, it could be difficult to arrange a set of trays that will be suitable for all dental teams at the clinic. So in some occasions, you have to make compromises so that the tray system will maybe contains a number of instruments extra just to be able to fit several more teams. And there are a lot of studies on properly designed tray system that this can provide great work and financial saving. And it doesn't only reduce the cost, but it also increases the efficacy and improve the performance in the clinic. During the patient treatment, it is actually very, very important to have the right instrument in place at the set of in the operation room or in the dental setting at the dental unit. It's very difficult to find studies on dentistry, but we have similar studies from orthopedic surgery. Orthopedic surgery where you are dealing with surgery in bone structure, which is actually very, very close to what we are doing within dentistry when doing endo extractions and perio, for example. And in orthopedic surgery, there are studies that have shown that for every 20-minute extension of a surgical procedure, the risk for postoperative infections actually increased by 25%. So we must not only see to that procedures could delay or could be costly for the clinic, but there are also infection control aspects that needs to be considered. And getting back to one of the first slides, that one of the main issues with hygiene and infection control today are actually to prevent all situations where there is a risk for having to treat the patient with antibiotics. Because every single treatment with antibiotics, we will also strive antibiotic resistance, which is important to prevent. When breaking up after the treatment, there are items that should be reprocessed, and before reprocessing, when cleaning the operation area, the surgical area, we need also to consider environmental aspects. Things that must be recycled, and also the waste, things that we will be throwing away from the dental clinic. And using a lot of single-packed instruments will also contribute to a large amount of waste handling. Waste handling that will have effects on our ecology, and also have a cost for waste transportation. We have things that should be transferred, items and informatics that needs to be transferred to either other clinics or other clinicians. Decontamination, that is actually the very first phase after cleaning the surgical area. Before taking all the instruments, the items out from the room, you need to make sure that there is no dry biological material on your instruments. And actually the decontamination phase, that means to handle the instrument in such a way that they will be rendered safe for further handling, for further reprocessing. the most effective decontamination should always take place as soon as possible after the treatment. The amount of bacteria will increase over time if instruments are not cleaned, decontaminated directly after use. There is also a risk for several products that could cause corrosion on our instruments and will destroy the instrument surfaces, making them less delicate to work with. Today, washer disinfectors are extremely good at removing microorganisms and bioburden. And by having a tray systems, you will facilitate the flow of material all the way from treatment via the sterile room to storage. Pre-disinfection is an important part. When all surgical instruments after the decontamination phase, which should take place as soon as possible after treatment, best done directly within the treatment room before removing the instruments from the surgery, from the operatory. And when after decontamination, when the instruments are safe to handle, when arriving into the reprocessing area, instrument must be pre-disinfected. They should be pre-soaked and rinsed to prevent drying blood and to soften and remove both blood and microorganisms and biological debris from the instruments. And after the pre-cleaning, there could be use for the cleaning of the instruments. And cleaning could be done in a large number of ways. You can do the cleaning by automatic processes. You can do the cleaning manually, and cleaning could also be carried out using ultrasonic cleaning. But the cleaning must make sure to reach all the different surfaces of your instruments, both in lumen and joints and crevices. That should prepare the items for further safe handling and decontamination. Ultrasonic baths are extremely effective methods of cleaning your instruments, and the ultrasonic bath is actually about 100 times more effective in removing blood contamination than manual cleaning. And the maximum effects of a good ultrasonic bath is usually after 5 to 10 minutes processing time. In some ultrasonic baths, you can use a cleaning solution, and there are also different solutions that you can use for cleaning and disinfection within the ultrasonic bath. What you must keep in mind is that the ultrasonic solution can become increasingly contaminated with debris after each successive load of instruments that are being cleaned. So instruments should be thoroughly rinsed after sonication in preparation for sterilization. And this is also reason for decontamination and pre-disinfection of your instruments and items before you put them into the ultrasonic bath. But they should always be pre-disinfection, ultrasonic bath, and post-disinfectant to make the instruments safe for sterilization. Interesting thing with washer disinfector are that they are generally computer-controlled units for cleaning, disinfecting, and drying solid and hollow surgical and medical instruments. And there are international norms, standards for how effective washer disinfector must be in order to claim that they are washer disinfectors, also called thermo disinfectors. And there are also methods on how to validate the process to make sure that the washer disinfector are working in the right way. And with sophisticated, well-maintained washer disinfector, the automated method has been proven to be more effective for cleaning, and they actually achieve over 99% reduction in soil parameters. And going back again to the diagram with the different steps, the different steps within the reprocessing, you can see in this slide that a lot of the manual work can very easily be exchanged, can instead be done effectively with the washer disinfector, and that will actually both render a safer product and will also save a lot of personnel time, which could be used for other things within your dental office. After the disinfection, we need to do the sterilization, and the sterilization should be a validated process that should be used to render a product free from all forms of viable microorganisms. And that also includes to inactivate bacterial endospores. The problem with the sterilization process is that the presence of microorganisms can only be expressed in terms of probability. So in all disinfection and sterilization processes, they must be done with a very large margin of safety, with something that we call an overkill, to be sure. So there is a measurement, sterility assurance level, that is interpreted as in 1 million sterilized instruments, there must not be more than one viable microorganisms, which is actually a theoretical measurement. And in the next slide, here is an example on how you can calculate microbial inactivation. A normal contamination level, as you can see in the upper left corner, normal contamination is 1 million microorganisms in a certain instruments. And then you can count different inactivation factors. If we go from the contamination level of a normal contamination of used instruments down to what we consider to be visually clean. Visually clean, we are down to 10,000 microorganisms on the same item. And going from 1 million to 10,000, we have actually reduced the number of microorganisms with an inactivation factor of 100. 10,000 multiplied by 100 will render 1 million. So the inactivation factor in manual cleaning, the inactivation factor will be 100. Power cleaning, if we go from the normal contamination with power cleaning, a washer disinfector or an ultrasonic bath, we will reach down to about 1,000 microorganisms on the same item, and that will be an inactivation factor of 1,000. Chemical disinfection of items, we will get down to 10 microorganisms on the same instruments if carried out the right way. So by using all these inactivation factors, we can add the inactivation factors together. If we start with manual cleaning, rinsing, wiping, soaking, and then add the ultrasonic, we will have 100. We will get both inactivation factors, so we will actually reduce to a very, very low level by adding all these different steps in the process. And that is a way that you could use to verify your process by going through different steps, different inactivation factors. The washer disinfector, the thermal disinfector, actually have a theoretical inactivation factor where you come down below zero, theoretically calculated below zero. And when we talk about the so-called sterility assurance level, which I mentioned in the last slide, we can measure the reduction of microorganisms down to zero. On the bottom side, we cannot measure, we can stop the process at different steps to measure how many microorganisms will there still be on the instruments. But below zero, we can only do a theoretical calculation. And this theoretical calculation, that will be the safety margin on your instruments. So actually, looking upon this picture, this diagram, starting with instruments that have been gone processed through a washer disinfector, we will actually reach a much, much higher, much deeper safety assurance, sterility assurance level when adding the sterilization process. And it's also the same when doing all these steps manually. The more steps we add before putting the instruments into a sterilizer, the safer will also the process be. And it's very, very important to understand that the soiled instruments can never be sterilized. All items must be ultra clean in order to make the sterilization process successful. We need wrapping on our instruments, and the wrapping will be there so it's possible both to transport and to store the instruments under safe condition. And there's different type of wrappings will save the instrument during different certain periods of time, depending on the quality, the type of wrapping that are used in the clinic. And it has been shown that instrument trays in sterile wrapping are actually safer storage protection than solid cassettes against microorganisms penetration. And this is an important step to preserve our instruments as sterile instruments, so they will be sterile actually at the point of use. A simple way to compute, to calculate the number of instruments, the number of items needed in your clinic is to specify the type of treatment that will be carried out at your clinic. Further, what type of instruments are needed for certain procedures. And what number of instruments will there be in circulation in the clinic? How long is the time needed for reprocessing of instruments? And how many patients would be able to be treated by the number of instruments that are in circulation in the clinic? And from pediatric surgery, there is a study showing that tray standardization can result in the removal of 40 to 70% of all instruments. Now, this is a scientific study regarding pediatric surgery, but my experience from the dental field, for having worked with a large number of clinics during the last 30 years, is actually that the evaluations that I have been part of, we have seen that the same number of instruments can be removed even from the dental clinic. And by removing the surplus, the redundant number of instruments, there will actually be room for spending more time, spending more care on the instruments that are actually in circulation. So by reducing the number of instruments in your clinic, you will also increase the quality of the remaining instruments. Another way to calculate the number of instruments needed, if you see the red boxes, that will be the treatment time when the instruments are actually in use at the operatory when treating the patient. And if the patient treatment will be 30 minutes, to reprocess those instruments, if we calculate that those instruments need 50 minutes to be reprocessed, and then we can see that we can have 1, 2, 3, 4, 5, 6 red boxes, 6 treatments, each one 30 minutes. And to get even with those 6 30 minutes treatments, if the reprocessing time of the instruments is equal to 50 minutes, we will actually get in level with each other at the point of 180 minutes in 3 hours. So that will give, in this example, that will give a quota that with 3 instrument sets, 3 different trays, you could actually treat 6 patients, as an example. So the ratio will be 6 to 3. You need twice as many trays, instrument set of a certain type of instruments for a certain procedure to be able to fulfill the type of treatment that was planned. And this is a way how to calculate. And of course, by adding more personnel, more dental team to the clinic, you would continue to do the same calculations for each team to finally end up in the number of instruments needed in the clinic. Usually you end up in a figure that the type of treatment that you need to be able to carry out, as in the further picture, dividing into different types of procedure. You need to multiply the number of treatments you want to carry out in a specified treatment. You need to multiply with somewhere between 1.5 to 2, double up the number of trays needed for each type of treatment to get even. When discussing logistics, you also need to consider the flow, the distance, the frequency of treatments, and where you have the risk zones. The flow of instruments, how will instruments be transported through the clinic? Will they be transported in a safe way, safe for both the personnel and for visitors and others? How far is the distance that instruments needs to be transported? Is it short distance, long distance? Is there a difference in floors? And this also has to be considered when calculating the reprocessing time. So not only the time in the sterile supply area, you also need to calculate for flow and distance and the frequency. How often are you carrying out certain type of treatments? And where are the risk moments? Where are the risks that there will be shortage of instruments? And also from infection control, you need to include where do you have high risk zones? Where is there a risk that contaminated instruments and other instruments will interfere with each other in the clinic? And try to find out routines to avoid instruments interfering with each other during transport. Frequent touch areas. Are there certain areas where there are a lot of personnel or a lot of visitors visiting that could interfere with flow, frequency and distance? And where do you need to be very prudent with disinfection, especially nowadays in the COVID-19 pandemic area? There are a lot of benefits going through, considering your logistics, the number of instruments in traffic at your clinic, and the type of systems that you are using to reprocess your instrument. And if you spend the time doing prudent logistics, you will optimize credibility, economy, hygiene, infection control, also quality and workflow. A very easy way to start keeping track on your instruments will be when the instruments are collected, are returning to the sterile supply area for reprocessing. You can keep track on the number of instruments coming back from the dental operatory, the type of instruments being used, the number of instruments being used, and by whom they have been being used. You can do this as a very, very simple calculation just with paper and pen. Or there are also sophisticated systems, either where you can use barcodes, and there are also systems available, more sophisticated system, where you can use digital ID on each animal, digital chips to recognize, to keep track on the instruments. But you can do this very, very simple with paper and pencil as well, just to keep track on the number of instruments. And of course, depending on the size of the clinic, larger clinics, there is a great advantage of having computerized logistic systems to keep track on, and also to achieve traceability of your instruments and your processes. Now just some statements from users of this system. This is from one dental assistant in Stockholm, Sweden, who has been using the Practipal system for over 20 years. And it saves a lot of time in all. As she mentioned, it's extremely time-saving for the staff. There is also testimonial from this other clinic in Slovenia using the same system and improving their logistics. Much appreciated by the dental assistants, and also the simplicity and versatility in using tray systems. And I mean, there are several tray systems on the market, and there are many advantages going through your logistics, going through the way you are using the instruments in your clinic, and the number of instruments you have in use. And there are also possibilities to use disposable parts in the system. And to try to get systems that are as integrated as possible, where you can see it as a Lego system, where you can build on and build off different functions depending on what needs to be, what you are doing, how the work is carried out, the routines in your clinic. You can organize the tray system so it fits your own way of working as maximum as possible. Tray systems should also see upon the function of the sterilization process. Actually, the lighter, the less weight you will have in your sterilizer, it will actually be a more safer process, if not too heavy loaded. And a lighter load in your autoclave chamber will also require less energy. And sterilization cycle will be shortened. And this will also be considerably cheaper when using less energy, less time, and less demanding on the process. So I hope all of this will give you some additional views, some initial views on logistics, which is, I believe, very interesting and very necessary to work with in the dental office. Not only in the dental office, in all healthcare fields, we need to work a lot with logistics and consider how we can improve the routines. And it's both time saving and instrument saving, and also an area where, to be successful, you need to involve the whole dental team in going through all the different aspects of logistics. And if you do so, I know you will be very satisfied and very successful. Thank you very much for your attention. Thank you very much for attending this webinar. I have a couple of questions that has been coming up on the chat that I will try to answer. And one of the questions is, can you please explain what are consumables? And by consumables, I mean the same thing as disposable items, which we have a lot, like paper points, cotton pellets, napkins, gauze, and other single-use items that should be thrown away or handled as waste or recycling from environmental reasons, which are important. That was one question, and I also have a question concerning my thoughts about reprocessing gel. Reprocessing gel, there are several on the market, and most of them, they should of course be classified as medical devices to be used in medicine, and it's important that we differ between medical products and consumer products. For all medical devices, we have very strong regulations on the quality and what they will perform, how they will act, and we should always use certified, classified, quality-wise medical device directive, medical devices. The difference with the consumer products is that the only thing you have to prove with consumer products is that they are not harmful for the user. Consumer products, which you can buy in any store, they are not covered by the same strict regulatory things as medical devices are. And the good medical reprocessing gel, that is a very good way of pre-disinfect or decontaminate your instruments. So I think they are very good. There's another questions on what to do about handpieces. Well, handpieces you need to treat in special ways because you have long internal lumens, and you will have, even in the best types of dental handpieces, there will always be a back traction of fluids. In more modern handpieces, there are different devices to reduce the back traction, the back suction into the instruments. But you will always get contaminations into the internal lumens. And there are specific methods and specific devices to clean handpieces, not only on the outer surface, but especially in the inner lumens, in the inner channels and the inner areas of the dental handpieces. That's very important. And if not cleaned properly in the internal lumens, in the internal areas and water and air channels, dental handpieces are not possible to sterilize. So they must be thoroughly cleaned, both internal and external, before sterilization. That is very important. I also have what is best to use in the clinical surface to clean surfaces between patients. Well, if it's just surface on like boards and operatory and things like the clinical surfaces, the best to clean between patients is to use a good disinfectant, and it should be a disinfectant also containing some sort of detergent. So it's both a cleaning action and a disinfectant action. And you have to define again which are the critical surfaces around the setting where you do patient treatment. And all the critical surfaces must always be disinfected between patients, and bestly done by using alcohol-based surface disinfectants. And if any one of you have more questions, I will be more than happy to answer questions. We have a very high quality within our dental profession that we should be proud of and that we should take care of. And with this also comes using very high quality products that are certified as medical devices. That's always very possible, very important. So I guess that's all the questions that will end this session, this webinar. And again, thank you very, very much for taking part of the webinar. And thank you very much for all the questions.